Sleep is so critical to our health and the prevention of chronic illness, but yet it is so poorly done in America. We tend to wear it as a badge of honor, and we brag about how much we can do on very little sleep. Like, I can do XYZ on 4 or 5 hours of sleep, or, you know, Sally is such a great employee. She's sending out emails at 2 a.m. And it's time to stop that, because it's really harming our health. And there is quite a lot of science behind the effects of deficient sleep or poor sleep, to the point of it affecting many of the chronic illnesses that are most common in the United States. For example, the #1 killer still remains heart disease. Several of the factors that impact heart disease can be worsened by poor sleep. For example, if you're sleeping less than 6 or 7 hours a night, it makes your fasting blood sugar go up. It makes your fasting insulin go up, both worsening risk of heart disease as well as risk of diabetes. In addition, that lack of sleep can raise your C-reactive protein, which is a marker for inflammation that can cause damage in the heart vessels, leading to heart disease. Poor sleep, less than 5 to 7 hours a night, impacts your immunity. You're more likely to get sick or to not be able to have your immune system adequately provide surveillance and mutating cancer cells. So poor sleep can be risk factors for those illnesses as well. In fact, getting less than 5 hours of sleep a night actually impacts our reaction time, and it's similar to driving with a 0.05 alcohol level as far as our reaction time and our likelihood to drop off into sleep just for microseconds, which can be devastating and disastrous. So poor sleep isn't just about, you know, I'm gonna work now and sleep later, or when I'm retired. You have to sleep now. Sleep can be disrupted by many things. It can be disrupted if you have pain or an injury that, you know, wakes you up or prevents you from sleeping. Anxiety and stress, as well as various hormone balances, can prevent you from being able to fall asleep, stay asleep, and get into deep restorative sleep. Poor nutrition, one of the biggest things that interferes with sleep is alcohol. Typically what happens is alcohol makes us sleepy, so we think it's good. Oh, this is gonna help us relax and get to sleep. Well, what happens is that, 2 in the morning, when that alcohol wears off, you have a very mild withdrawal from the alcohol, and people will tend to wake up. And sometimes it can be hard to fall asleep. So when I counsel my patients on what to do with sleep, we go back to very basic sleep hygiene measures. Not drinking liquids after dinner time, avoiding alcohol, making sure that you go to bed at the same time every night and that you wake up at the same time every morning, even on the weekends. So, and ideally, to get the best quality and best rhythms of sleep, you want to be asleep before 10 or 10:30 and be getting up, 6:30, 7 in the morning. It's the best sleep time to match circadian rhythms and for adrenal health. The second thing is, our bedrooms can be very busy, noisy places. Many people have TVs in their bedrooms. Many people keep phones in their bedrooms. It's really critical to get that stuff out of the bedrooms and have a nice, cool, less than 70 degrees, dark, without, false light in the room, to help calm and get melatonin levels flowing. Now, melatonin is a hormone that's very important for sleep, and that can also decrease as we age. And when it's deficient, it can be very helpful to sleep. The other thing is getting pets out of the bedroom. They can be disruptive if they move around, or you can hear them, or they even lay on you and raise your body temperature and wake you up. In addition, sugar in the diet can disrupt sleep because it can raise the insulin levels. If you have a sugary snack before bed, the sugar drops at night and you wake up because you're hypoglycemic. So, diet, stress management, and controlling anxiety, nutrition can be important for sleep, as well as those sleep hygiene measures. Now, there can be other underlying causes for sleep problems that can be treated. For example, as the obesity epidemic in America raises, more and more people are developing obstructive sleep apnea. And that's where, as you relax and go into deep sleep, the muscles of the neck relax, the airway closes, and now you're struggling to breathe against that closed airway, the oxygen drops, and you have to wake up or you're going to die. So people who have sleep apnea might wake up every minute And so they're not getting any deep restorative sleep where, you know, our memories can be processed and healed. Growth hormone is made, which heals and repairs and restores us. And they're not getting dream sleep, which processes their anxiety. So it's very important to detect and treat sleep apnea. And short of that, it's best to avoid medications for sleep if possible, because many of those medications disrupt the normal sleep cycle. So we usually go into a sleep cycle, it takes about an hour and a half, where we're in light sleep, where we're kind of unconscious but very easily awakeable. And then we drop into a deeper sleep, then REM sleep, which is dream sleep. And then we come back up into lighter sleep again. And we go through about, you know, 4 or 5 cycles of those a night, each lasting about 90 minutes. Each cycle, the REM sleep or dream sleep gets longer, so it's important to have uninterrupted sleep where you're getting progressively longer dream sleep to adequately detox emotions from the body, adequately heal, repair, and restore. And so the goal with the management of sleep is both to create that healthy environment for sleep, get adequate sleep, as well as support, you know, the hormonal functions in the body that might be out of balance and preventing sleep.